Welcome to This is Healthcare in America. I'm Reid Zeising, founder and CEO of Cherokee Legal Holdings. Have you ever wondered what it'd be like if air travel worked like healthcare? If you haven't, there's a painfully accurate YouTube video called If Air Travel Worked Like Healthcare that you should check out. It's a well-executed parody of the frustrations felt by millions of Americans on the subject of healthcare. And it's one of the best examples of how our current healthcare system works. So let's dive in. When you pay a healthcare-related medical bill, you're not only paying for the care you receive, but you're paying for the wasted inefficiencies behind the scenes, all of which, since it's rolled up into the cost of your medical bills, makes everything that much more expensive. James Caan wrote in the National Academy's Press that there are very substantial administrative costs in the U.S. system, making up nearly a third of all spending. Through a complex payment systems, the cost of care that you're paying includes the salary of doctors, nurses, medical technicians, all the way down to the line item employees, medical billers, insurers, and subcontracted workers. It's an inefficient system, compounded every step of the way, every hand that touches every bill, all adding up to the total cost and confusion that is the modern-day healthcare system. This is where the 2010 YouTube video I mentioned comes into play. It dramatizes the utter ridiculousness of the overly complex administrative spiderweb that ends up costing all of us more. Since the rules are in place are completely non-transparent, patients end up footing the bill, and it quite exceeds the care they actually receive. As medical bills move through the system, complexity, variability, and friction all add to the problem, and substantially the cost. What's worst? The overall cost of healthcare is skyrocketing, and it's only on pace to continue increasing. The actual cost of healthcare is routinely hidden from the eyes of patients receiving the care. When doctors order tests, procedures, or medications, very few of them have any idea how much these line items cost. They simply order what they need and expect the patient to foot the bill, no matter the amount. Payment for these kinds of services can differ from patient to patient and vary widely depending on the patient's insurance plan. Hospitals have their own separate billing departments. They aren't directly connected to the doctors or the tests and procedures that they order. It's just a fragmented system on the inside, let alone from the patient's perspective, making it tough to track and easy to pad with hidden and inflated fees. When it comes to the money that's going into healthcare insurance companies, they in fact control almost all of it. The more healthcare costs continue to increase, the more power the insurance companies have. Excessive administrative costs, lack of transparency, and billing inefficiencies continue to drive up the total cost of healthcare. Not to mention, it's taking patients more time than ever before to pick away at the increasing costs and medical debt that they've incurred from our broken system. According to the Medical Billing Advocates of America, hospitals and clinics routinely overcharge their patients for services. That's a fact. Like carefully reviewing your credit card statement at the end of the month, it makes sense to do a review of your medical bills. But how is anyone, especially the average person, able to decode all of these line items? It's almost impossible. You are, however, able to put your foot down when it comes to bogus fees like an oral administration fee. Do you know what that is? It's actually the nurse handing you your medication in a little paper cup. Or if you're charged for a technical problem, like an X-ray that needed to be taken twice because the machine had a clarity error, or there was a misreading of your X-ray by the doctor. Well, you're not able to sue a hospital for the overcharges that may compile on your bill. Asking questions and following up can be a huge benefit as you begin to examine what your true cost of care totals up to. Combating the skyrocketing rates of healthcare is directly related to the importance of the Seventh Amendment, which is our right to a trial by jury, especially when it comes to the hotly debated topic of tort reform. Plaintiffs need help covering the cost of care and medical bills that quickly pile up given what's happened to them. Situations that often aren't even their responsibility, let alone expecting them to have happened. Had the medical bills not been so expensive in Stella Liebeck's case in 1994 in the product liability lawsuit when she spilled the hot McDonald's coffee on her lap and was so severely burned she required skin grafts and surgeries, Mrs. Liebeck may not have even opened up a case that made McDonald's come face to face with the fact there was a larger issue. The fact that over 700 other individuals had reported McDonald's coffee burning their bodies. Some would argue that tort reform would lower the cost of healthcare, but this comes under a guise. The thinking here is that if doctors aren't so worried about getting sued, they wouldn't be ordering every test in the book to cover all of their bases. Tort reform is often an easy target. Supporters demonize plaintiffs' attorneys and contest that frivolous lawsuits are clogging up the judicial system and increasing all medical costs. Though the true measure of reform here may instead be rooted in the cost of healthcare itself. A major study published in the New England Journal of Medicine, conducted by a team of 5 doctors and public health experts, who decided to dig a little deeper to see if states where tort reform measures were passed nearly 10 years ago, Texas, Georgia, and South Carolina, made a difference in the cost of care. And here's what they found. It did nothing to reduce the cost or the number of expensive tests and procedures that doctors had ordered. In Liebeck's case, she just wanted McDonald's to cover the cost of her medical expenses that Medicare wouldn't cover. That seems fair, right? When we're speaking about those individuals who are pushing for tort reform, these are the people working to try and limit the value of a human life, cap damages, and restrict the ability for citizens to bring an issue to light within the court of law like Liebeck did. Truth be told, medical billing is only a fraction of the issue. What would really move the needle in terms of healthcare and tort reform is increasing medical pricing transparency. Consumers should be allowed to see the cost of care and everything that goes into their care ahead of time. This would cut down on the back and forth between providers, patients, and insurance companies, and give people back the choice of care they receive and how their money gets spent on it. Usual and customary charges are well established, and the free market system should allow for providers to market their services at both discounts and premiums to these rates. There are times when a well-qualified medical expert may cost more than standard reimbursement rates. And at the same time, the free market can drive down the prices of services that are more commodity-like. The importance in maintaining a citizen's ability to exercise his or her right inherent in the 7th Amendment is paramount. I find this especially important when plaintiffs and attorneys are trying to keep larger corporations, businesses, and individuals accountable for their actions. Focusing on the fable of frivolous lawsuits is a sideshow to the real inefficiencies that need to be addressed in healthcare reform. A truly transparent marketplace needs to be created in order for any real change to take place. Trying to demonize plaintiffs and suppress the 7th Amendment does nothing but limit the accountability of individuals and corporations who, without these checks and balances, have proven less than honorable. Trying to alter and ultimately narrow the scope of individuals to seek justice does not do any good for our country or the standards and precedent we put in place moving forward. That's all for today. Please join me next time on This is Healthcare in America. And in the meantime, please stay out of the hospital.